My name is Dr. Christine Kaczmar. I'm known as the Digestion Doc, and I help people regain their freedom from the crappiest, yes, crappiest health conditions like Crohn's, colitis, IBS, constipation, nausea, that kind of thing. Today we're going to talk about two things. When it comes down to digestion, there are really two keys that you really need to be knowing about. So I'm just going to go ahead and turn this around. And if you guys get any value out of this, please share it. The more people that learn about, what health is and how to take back their health, and the more people we get just to be responsible and accountable for their health, the happier and healthier this world's going to be, because I think people are really relying too much on medicine and big pharma. And, digestion is a huge, huge key component to overall health. I mean, health really is all about the gut as far as I'm concerned. Today we're going to talk about the two keys to digestion. Okay, now these are very, very important. Two keys to digestion. Number one is going to be how well you break down food. I'll step back so you get a bigger look at this. All right, step one, the first key, how well you break down food and convert it to nutrition. So understand something. Commonly, you're going to hear a phrase, you are what you eat, right? You've all heard that. Raise your hand right now. I can see. Yep, I can see. You all have your hands up if you've heard that. You are what you eat is a false statement. False. It's not accurate. What should be better stated instead is, you are not what you eat. You are what you digest. Way, way better. Far different distinction there. You are not what you eat. You are what you digest. So the next time you hear somebody say, oh, you are what you eat, just tap them on the shoulder and say, actually, Carmine, it's not true at all. It's better said to say, you are what you digest. And here's what I mean by that. Just because you eat something healthy like chia seeds in your smoothie or avocado with your salsa does not mean that your body is going to effectively get that into your cells. So that's what digestion is really all about. Okay? Digestion is how well you break something down, transport it, absorb it, assimilate it, utilize it, excrete it, all of that. That's what digestion is. Digestion is many, many things. To say that you are what you eat is just minimalizing it. It's not at all as comprehensive as digestion really is. All right, so two keys to digestion. One, how well you break down food and convert it into nutrition. And then number two, and this is why I'm a busy doctor, unfortunately, but obviously I need to help people. It is how well you eliminate waste. Okay? Digestion comes down to these two keys, you guys. One, how well you break down food and convert it into nutrition. And two, how well you eliminate waste. This is huge. How well you eliminate waste. So how well you eliminate waste means more than just a bowel movement. It also means how much you're urinating. It also means how much you're sweating, crying, coughing, how well you're breathing. These are all vehicles to remove waste. Okay? Understand something. Your lymphatics, okay? You've probably heard lymph nodes, right? Lymph nodes are pretty much they're like a hotel for white blood cells. So white blood cells live in your lymph, okay? And your lymphatics and your immune system, they're like the same thing. They're like the same thing. Lymphatics and the immune system, the same thing. Your lymphatics is basically a sewer system in your body. Okay? It's your body's sewer system. It's how we eliminate waste. So yeah, your lymphatics is like your sewer system. Okay? So you want your lymphatics to be moving properly. And so when I say key two, point number two is how well you eliminate waste. Understand that if your lymphatics are clogged up or stuck, then you're not going to remove waste properly. So how do you move your lymphatics? Here's how. Breathing properly. Okay? Breathing properly. Your lymph only travels in one direction, and what runs through your lymph is not blood. It's lymph. It's an actual fluid. If it gets blocked because of inflammation, that's where you're going to see edema. That's where you're going to see collection of pollution in your body. That's where you're going to see constipation, diarrhea, heartburn, things like that. So breathing properly is really key. A proper breath means that when you inhale, you should be filling up your bag of like your lungs are a bag, and you're filling them up. So you could almost feel your diaphragm moving toward your feet, okay, like you're expanding. And when you exhale, you want to be pretending that you're pushing that air up through, like the diaphragm's moving up and you're exhaling out. So unfortunately, most women, most females breathe improperly. They breathe very shallowly, and that's not good. It doesn't behoove you to remove pollution and debris from your body if you're breathing really shallow. So a good step to really help clean up your immune system and your lymphatics is to be a better breather. You got to practice this, okay? There are patients I see on my table who I tell them to give me a big breath in when they're face down, so my hands are on their back. I say, give me the biggest breath in that you can possibly muster up, and my hands never move, okay? You should be really expanding your lungs so much when you inhale, so practice that. The next way that you could really move your lymphatics is by getting massage therapy regularly. Also being on a rebounder, a trampoline. Let me go ahead and show you guys what that looks like. You've probably seen or heard about these little mini trampolines. Well, they're really important because they help to move the lymph. So let me just show you what this looks like. Sorry for the close-up. So this is a little mini rebounder, okay? You just jump on this, and that's all you do. So those are 3 quick ways that you could help move your lymphatics, okay? We're talking about 2 keys to digestion. Number 1 is how well you break down and convert, how well you break down food and convert it to nutrition. Remember, you are not what you eat. You are what you digest. And then 2, how well are you eliminating waste, okay? We talked about the lymphatics. This is the main way that our body removes waste. Your lymphatics is much like your sewer system. So if that system is plugged up, bad news, okay? Bad news. I don't know about you guys, but when I grew up, we had a septic tank. Anybody out there know what I mean? And when that thing backed up, that poop and sludge and whatever else they call it, it would bubble up over the grass. Ugh, scary, right? Imagine if your body has that kind of situation where it's backing up and getting full of pollution. You do not want that. And so the main reason why I help people with Crohn's, colitis, IBS, constipation is that people are having problems eliminating their waste, okay? Here's a little bit more about where you can find me. TheDigestionDoctor.com, ScopeTestKit.com. That's a little bit more about my testing. Here's my phone number. There's my handle. And if you want to see some of my videos that are on Catch, go to catch.me/The Digestion Doctor. Over 200 videos over there for you. So you can be checking that out.